Hello, my name is Anatoly. I'm a registered nurse. I'm doing a mini physical basic exam for the head, ear, eye, nose, throat. Um, so basically, what I want to do first is to introduce myself to my patient. So this is my patient. What's your name?
Kenny.
Kenny. Kenny, I'm Anatoly. I'm a registered nurse and I'm a student at the University of San Francisco, so I'm doing my master's in clinical nurse leadership. I want to ask your permission if we can be able to do a physical exam regarding the head, ears, eyes, nose, throat. Is that okay with you?
Yes.
Okay. Any moment they feel uncomfortable, just let me know. But there will be a little bit of touching with the some parts of your body. So I want to start with the orientation of the patient. So I want to ask, like, Kenny, do you know where you're at?
Yes.
Where are you?
Hospital.
Do you know what's the date today?
It is February 23rd.
That's correct. Do you know who is the president before Barack Obama?
Yes, George Bush.
So the patient is oriented times 4. So you want to gauge this one just to assess the memory and the mentation of the patient. So we're going to move forward to the head. So in assessing the head, you want to use and see uh, the hair first, how it looks like, if it's oily, if there's any dandruff, is any bruises or wounds, and then afterwards you're gonna go and start palpating the hair. So you want to take a look if there's any bumps, any lesions. It looks like Kenny has a head hair. It looks like he just got out from the shower. And then the next thing you're gonna do is you want to assess the face. So when you're assessing the face, you want to assess any, you know, the any wounds, any scars, any and of course the symmetry of the face. So can you smile for me? You want them to ask to smile just to make sure there's no facial drooping of the patient. And then you're gonna go um, ahead to assess the temporal pulse and the temporomandibular jaw, which is a TMJ. Do you have any pain for that?
Mm-hmm.
And then you're gonna go ahead to assess the sinus. So, do you have any pressure?
Mm-hmm.
Any pressure?
No.
Okay. So we're done with the sinus examination. We're gonna go and move ahead to inspect the eyes. So the first thing you want to go and look assess for the eyes is you want to see and the symmetry. Of course, you want to inspect any symmetry. If there's any foreign bodies in his eyes, if he's wearing contact lens or not, also. And then after that, I'm gonna pull out my pen light. Basically, I have to go back. So you want to check for the sclera of the patient. Usually, the normal sclera is white and shiny, which is Kenny has one, and then you're gonna go for the conjunctiva, which is you have to put down an eyelid and look if it's pinkish to reddish. So his conjunctiva is pink and red. Um, After that, you're gonna go and look for assess for the pupils. So for you to be able to do that, you have to get a pen light for you to be able to assess the pupillary action. Ideally, in this situation, the the surrounding should be darker, so you'll be able to um, appreciate the constriction and dilatation of the pupil. So what you want to do is that you have to shine the light upon to the right pupillary pupil, and then the left pupil should be constricting. And then shine the light upon to the right pupil, and the right pupil should be constricting also. So you're pretty much going to do the same way too. Shine the light upon to the left pupil, and the right pupil we're going to constrict. Shine the light upon to the left pupil, and the left pupil we're going to constrict. Moving on, we're going to assess for the ears. So for the ear, you just want to go and look for, inspect the symmetry of the ear. And then I want to go and start assessing for the tag test. So usually using the tag test, you just want to pull up the pinna. And then if there's any inflammation, usually the patient will going to feel any pain for that. And then I'm gonna do the same way too on the other one. So pull up the pinna. Is there any pain?
Mm-mm.
Good. Moving forward, we're gonna go and assess for the internal canal. For you to be able to do that, is you usually have an otoscope. Unfortunately, I don't have one, so we're gonna improvise something. So we're just gonna use a pen light. So for an adult, you just want to go and use or do like pull and back to see the internal canal, to check any discharges, any serum in. Just clear. And then you're going to do the same, the other one. It's pretty clean right there, clear. No discharges, no drainage. And the last examination for the ear is usually you're going to use a tuning fork. I don't have any tuning fork, so I have to improvise something, which is comprised of the Weber and the Rins test. So what will going to happen is the Weber test usually assesses the conduction to the ear. So they usually do this if you strike down the fork and then you put the fork on top of the forehead of the patient. The normal finding should the patient would be able to hear both ringing sounds on both the right and the left ear. And then the ring stance, you're gonna strike down the fork, and then you're gonna put the fork at the back of the patient's ear until the patient doesn't hear it anymore, and they're gonna put the fork closer to the patient. The patient should be able to hear the ringing sound because air conduction is greater than bone conduction. So it's pretty much the same. You're going to do the same way too in the other ear. So you want to strike down the fork and then put the fork in the back of the patient's ear until he doesn't hear it anymore. And then, do you hear it anymore? And then you're going to put the fork closer to the patient and then remove it until the patient doesn't hear anything anymore. Moving forward, we're gonna go to assess the mouth area. So just like in other parts, we have to inspect first. So you want to inspect any cracks, any wound, any sores for the mouth, and then afterwards, you're gonna have your light on, and then you're gonna ask your patient to what do you call this? To open his mouth. Say Okay. You wanna inspect the mucosal membrane, and then stick out your tongue for me. There you go. So by sticking out his tongue, you'll be able to see the tonsils, the uvula, and other and the soft palate too. Usually it's pinkish red. So his is pinkish red. Moving forward, we're gonna assess the neck area. So for you to do the neck area, you should be able to look first to inspect the neck area if the trachea is in the midline. It's in the midline right now, and then after that, you're gonna start assessing for the lymph nodes. So you want to start assessing for the lymph nodes. It starts with the preauricular, which is before the ear. So by doing this, you want to use the three fingers of the pads of your fingers, and then do it in a circular motion, and then post auricular, which is the back, and then tonsillar, submandibular, and submental. You can assess also the anterior parts of the trachea, and then you want to assess also the supraclavicular, which is on top of the clavicle, and then infraclavicular, which is below the clavicle area. And then you're going to go occipital. So you want to palpate any lesions or any lymph nodes. Normal lymph nodes are usually mobile and non-tender. Moving forward, the last part of our assessment will going to be the assessment of the thyroid. So what you want to do first is to inspect the trachea if it's in the midline, and then we're going to do it posteriorly. So in assessing the thyroid, you place your both hands on the side of the trachea, which is pretty much just below the isthmus of the thyroid. And then once you see it, you let the patient swallow, Kenny. So the isthmus of the thyroid, when they swallow, it usually goes up, and then it goes down in resting position. So pretty much that concludes our assessment of the head, ear, eyes, and nose and throat. Hopefully you'll be able to hear and learn something from it, and I'll see you soon.